Okay, so my name is Gwyn Williams and I'm one of the candidates for Plaid Gŵyr-Abertawe, and I will be interviewing Dr. Vanessa Webb today about social care, one of the most important and pressing issues of our time. So Dr. Webb, would you mind telling me a little bit about your background, please?
Yes, I was born and brought up in the Rhondda Valley. I've lived in lots of different places, London, Midlands, Oxford and so on. My work is that I've been a community worker, I've been a teacher for a period of time, not a very good one, and I've run all Wales organisations, and for the last 15 years I've been a researcher. So it's mostly covered the social care field, various aspects of it.
Now, what is the problem with social care? I mean, as a doctor myself, of course, I see the hideous implications for the NHS itself and its efficiency with a lack of social care service. But you, of course, are an expert in this and have done a lot of work. Would you like to tell me the basis of the problem?
Yes, well, I've got a lot of experience. I don't know about being an expert. And I think it's important to remember that where social care has an effect on the NHS, so the classic case, of course, is people not being able to get out of hospital beds because they've got no social care package. It also works the other way round. So if people don't have the right medical care, they actually then become either a burden on social care, or they become that they lose their independence and lose their quality of life. So it's mutual in that sense. They're two different organisations because they've got different ways of measuring the results and the quantity and the quality of what they do, but they are definitely mutually respondent. I would say that one of the problems we've got now and have had for a long time, partly because the NHS is so understood and so praised, it's free at the point of use, that social care is sometimes seen as a kind of a handmaiden. And the idea with Dr. Di Lloyd was that we should be looking at a national care service, which would be the equivalent or the partner of the NHS, and it would be the ideal, the vision, to get eventually to a care service which was free at the point of use. Now that's quite a long way off, but that's the vision that has developed and has even been adopted by Welsh Government.
So before we get into the details of how such a service would look, let us look into the cost of not implementing such a service. What would be the burden to our National Health Service of not doing so?
Well, I mean, we know that the burden on the NHS is increasing all the time, and that's because of the ageing population. So there's a higher percentage of conditions, ill health conditions. There's also the fact that we are diagnosing things more quickly and more frequently now than we used to do. So in that sense, the NHS burden is growing all the time. It will increase if we find that people are not getting the support for independence and quality of life at the social care level. I would say, can I go back a little bit when you were asking about the problems? One of the problems, I think, is also that people don't understand how broad social care is. I mean, the last time I looked at the figures, the number of full-time equivalents in the NHS last year, I think it was 113,000. Whereas the number of people employed, and they may not be full-time equivalents, but I'll qualify that in a minute, in social care was somewhere like more than 113,000. But what we have to remember is that the number of volunteers in social care, which are not jobs, is much, much larger than it is in NHS. So in terms of the breadth of the work that they do, the two are very comparable. I mean, I could go on a little bit about the breadth of work of social care, which people don't understand. I mean, I've got a whole page listing all the areas of work. You
mentioned Dr. Di Lloyd earlier, of course, because he was instrumental in this, and he often cites the fact that a stay in a hospital bed for a night is 2 to 3 times as expensive as a stay in a social care accommodation. And his tagline is always, of course, that we cannot afford not to implement a social care service. So economically, is it that you're saying that because of the burden of social care on unpaid carers, that it is a significant economic actor in the harm done to the health of our nation economically?
Well, certainly the burden on unpaid carers, I think a recent calculation was that if you worked out what it would cost to provide the care that the unpaid carers provide, in Wales it would come to something like £10 billion a year.
Whoa.
So it's enormous. But it's not just unpaid carers. We're talking about things like fostering, adoption, population assessment of needs, commissioning services. It goes on, the whole list of responsibilities of social care, all of which cover areas which, if they're not operating properly and are not funded properly, will put a further burden on the NHS.
So you've clearly made a very strong case already, in remarkably few words, I have to say, well done, as to the desperate need for fixing the social care problem. Now, you've done some work for Plaid Cymru. Would you mind telling us the background to that work that you've done?
Yes, well, the learning experience for me was working with Dr. Di Lloyd's group originally on looking at the details of a national care service, free at the point of use. Was it feasible? And that report came out in 2020 and was adopted by Plaid Cymru. In the cooperation agreement, it then became part of the social care policy, the national care service, became part of the agreement, and it was adopted by Welsh Government. The next stage was for Welsh Government to appoint an expert panel. Again, I was fortunate to be on that, and we produced a report putting in some of the details, some of the flesh on the bones of that idea of a national care service. And it is now a 10-year plan. There's an implementation plan. So what we have to remember is that things that really make a difference like this can't be done overnight. They can't even be done in one term of government. They take a long time. And one of the gaps that we've got is that we haven't got the costing and the calculations of the preventive care, which is how the whole problem is going to be eased. If we have the preventive care services, the early interventions, you actually put less of a burden further on in social care and then, as I said before, in the NHS. So there's a lot of work to be done on costing what local authorities now, because they're the primary deliverers, are spending on preventive care as compared to crisis management, or what we call business as usual. And when that's done, it'll be possible to work out where the balance is, how the balance can be changed. Now, I want to bring in another factor here. This is one of my pet things, I'm afraid, is social value. Now, all the evidence that we got from our social care research group, which we were also doing for Plaid Cymru, was that social value, that is the cost of providing help and support and making people independent, was not really central to Welsh Government thinking. And it's sad, because that is where the key lies to the problem of moving services to prevention and moving the burden further back to where not just are you saving costs of services, but you're actually improving the quality of people's lives if you can intervene early. I mean, there are so many examples. There's one of my favourite examples is there's a charity that is called Active Ageing, and they provide lots of services like activities, various kinds of activities. They do physical exercise, they do groups, they do lunches for people. And what they do is they go out and they fetch people in. Now, that is a charitable organisation, so they have to be funded, but the funding is much less than the funding would be if you wait for those people to get into a state where they can't move about, they're not mobile, they're suffering from loneliness, they're losing their social skills. So you see, that's the kind of balance we've got to include in all our costing.
I entirely agree with you. It is extremely difficult, of course, to come up with an exact cost because of the opportunity cost of workers who are otherwise employed in this and helping out relatives as opposed to contributing to the economy. And also the fact that prevention and stopping people from getting into a state of dependence is costing us much more than we know. And it is unfathomably difficult to work out the exact benefit, the masses of benefit that would be accrued through intervening. But you mentioned flesh on the bones. And I think all of the people watching this, they always like to know the actual flesh, the ideas, what will happen in perhaps a first term. What are the low-hanging fruit in this implementation of a social care plan, Dr. Webb?
Well, I can think of one specific example. You mentioned earlier about people having to stay in hospital. Now, I did for a period of time run a residential home, and we had a very, very, I suppose, fruitful programme in that home of activities and involving people and keeping them alert and enjoying themselves. And we offered the hospitals and the health boards to take people in who were not ready to go home as a kind of convalescence. We could not get any response from them. They were not interested at the time. But recently, and this is a good sign, a neighbour of mine has just recently come out of hospital and spent a few days in a residential home before coming home, preparing herself to be independent. And those are the that's one way in which I think if we were able to use the care homes and those convalescent services more, it would get people out of hospital before they become institutionalised, because that's the problem.
So are there any other low-hanging fruits? I mean, getting people out of hospitals, the so-called, and I think you would join me in thinking that the pejorative term bed blocking is to be avoided at many costs.
Yes, it's terrible term. Well, in fact, when I ran a residential home, I used to get very annoyed when they talked about how many beds have you got. And I used to say, no, how many people do we take? That's how we phrase it. It's very difficult to say at this stage because, as I explained earlier, there's a lot of calculation to be done. And there is a growing methodology now in calculating social value. It's being practiced. It's still got a way to go, but it is helping now to get some idea of putting a cost on the things that we were talking about. I would say about low-hanging fruit, better use of the third sector, because what we hear all the time from the third sector is that they're providing services where they can be funded. And sometimes they're not included in the calculations or the planning until quite late in the stage. And what we felt in the social care research group was it was very important to get the third sector involved at an earlier stage in the planning of services. I mean, if you think about it, a charity, any single charity, is closer to the people who need the service. They often will be able to find the issues or the situations that need care, minority ones sometimes, that perhaps large organisations or strategic working doesn't identify. And they're also able to act promptly. They're able to say, look, this is happening, and bring trends and tendencies to the notice of the planners, the service planners. So I think a better cooperation, or if you like, more attention to what the third sector is saying at an earlier stage in the planning process would be good.
And just, although it might seem a foolish thing to ask, for the sake of the people watching, by third sector?
Right. Well, this is, yes, it's a difficult term, isn't it? I'm sometimes being told I should talk about the independent sector, but it covers charities, voluntary organisations. You also have got to take into account that there are private organisations that contribute. But I think we're thinking very much about the charitable voluntary, the not-for-profit sector, really. That's what we're thinking about. So that is something that is going to take a while, but if we can get them into the planning, then we'll know that the money is going to where it will be best used and most cost-effectively used.
I entirely agree with you there. Rather than reinventing the wheel, so many wheels exist. It's just that they're acting independently of each other. What we need to do, of course, is to harness the power of all of these organisations and bring them under a whole. I entirely agree. Now, academics, in my experience, they always say more research is needed. That's their conclusion to everything. But in fact, you've researched this over many years. Would you mind telling me about the report that you've produced?
Well, the Social Care Research Group produced a report about 18 months ago, no, less than that actually, a year ago, and we did it for Mabon ap Gwynfor because he was the person with the portfolio in Plaid of Health and Social Care, and we sent it to him, and as I understand it, has been discussed by Plaid policymakers, and I was very interested to hear Delyth Jewell on the radio today talking about how prevention was the key. So I'm hoping that that message is spreading very strongly in Plaid policy and in general.
Yes, and what about in your experience, because you did this on the behest of Plaid Cymru, but what's your experience of other political parties in the Senedd and their attitudes towards social care?
Well, it interests me that a year ago, Baroness Louise Casey was commissioned by the UK government to look into social care and how it should be improved, restructured, whatever it took. And a short while ago, she came out with the statement that adult social care, and unfortunately this is where all the emphasis goes, adult social care was a mess. And then you get Stella Casey, who's a Labour MP, saying in an interview that what was needed was a national care service in England. So, I think that other people are beginning to wake up to this. But the fact is that this plan exists. The implementation plan exists. And I think what we have to do, and what the Social Care Research Group has been doing so far, is to monitor very closely how that implementation plan is being fulfilled. The first year annual report came out, and in quite a few ways it was quite encouraging, but there were things that were left out of there that we would like to chase up. For example, the costings of the preventive care and the degree to which preventive care is provided by local authorities. You need that information. So there's one other thing I'd like to add too, which is about social care. And it's on a local authority level. And you were talking about this, everybody working together. The thing about social care is that a lot of the services which have helped people to have a quality of life, to be independent, have in the past, they've been things like the libraries, the leisure centres, or the choirs, all those kind of things. And what we're seeing now is that with the cut in funding to local authorities, those are the very things that have had their services or their existences cut. And we really need to think of local authority level, of it all being involved. That is social care. I think somebody said once, even the milkman going round, he comes to the door and the milk hasn't been taken in, that's a signal, the postman and so on. And I think those things, that whole vision of everybody being involved, maybe we once had it, I don't know. But I certainly think that's what we need so that we're working as a community.
But to ask a very important question, as some people might say, well, why have a separate social care service? Why can't it be a part of the National Health Service that already exists? How would you respond to that?
How would I respond? Well, firstly, because, as I said, social care is as big as the National Health Service. Secondly, because social care has such a breadth of responsibilities. And thirdly, I suppose, because the way you measure the service is somewhat different. Now, I'm being very cautious in saying this because you might want to come back to me on this, but the way you measure the service in social care is perhaps different from what it is in health. Although I have noticed recently people I know who have seen the GP, they have been asked by the GP, what do you prefer? How would you like to see us go? Which is more like a social care approach. So it may be that there is, a closing of the gap now. But at the moment, I think there is a difference in the way we... And there has to be in one sense, because in health, you can measure people's blood. You can measure things. You can say, look, this is very clear that this is wrong. Whereas in social care, it's much more about how do they see their lives?
If I could humbly add another category as well, of course, is the importance of ring-fencing the funding around social care, because it is in the nature of the NHS, almost like a black hole of infinite depth and mass, to pull in and suck in all the resources around it to feed itself, without really realising, of course, that without funding social care separately, itself, it cannot function. So by pulling in the budgets, whilst if it is a separate organisation, its budgets would be clean and there would be a firewall between it and the National Health Service.
Yeah, well, you filled in for me there. You're absolutely right. It is about ring fencing. And of course, local authority money has been cut and cut. So it has suffered. I mean, I've got great sympathy with local authorities, particularly with social services, but with all the services, that they have been struggling. I know during COVID, I sat on a panel, a ministerial panel for Welsh Government looking at local authorities' performance during COVID. And it was amazing how the local authorities had found ways, new ways, of serving people, keeping people in touch. And I just thought they should be congratulated for all the gaps that there are, and there will be gaps and there will be disasters. I just think that they went to enormous lengths to innovate. And local authorities do. And of course, the third sector innovates as well. And that's something that we must always bear in mind. So we come also then to social prescribing, which I haven't mentioned, which we haven't got time to mention today. But, that's really a very important part of social care.
Well, before you wrap up and summarise everything, now that you've mentioned social prescribing, I think it would cheat our viewers out of knowing what that is if we did not at least touch upon it. Tell us in a nutshell what social prescribing is all about.
Right. Well, prescribing, normally you think of medicine or treatments like that. But in fact, social prescribing is, for example, saying to somebody, I think it would do you good if you went to an exercise class once a week. And another one might be, it would be good for you, your emotions and your loneliness if you joined such and such a group. And the problem that occurs here is, of course, some of these prescribed services would cost money. So there's a financial question here about whether you only socially prescribed to things that are free or whether you fund that prescription. But I think that's a really, really interesting way to go. And it's been going for a long, long time. It's been going, the first instance I remember reading about it was happening in the 90s. And doctors have been doing it, and social workers have been doing it. And I'm sure that, it's happening without us really knowing about it. But the point is, I suppose, to recognise its value and to say, look, this is a huge force for good, and maybe we ought to bring it into the main line, the mainstream.
I entirely agree with you as well about the lack of community having an adverse effect on people living alone. And it is a great tragedy, of course, and few people know that the social group in our society most prone to self-harm is in fact the elderly. And the social group most prone to depression are also the elderly because of loneliness and the collapse in our communities. So community, society, these organisations are absolutely sacrosanct in keeping people healthy. And if you were to look at things in a very pragmatic but also perhaps harsh manner, saving the state money through hospitalisations, because of course happy people are well people and happy people are ill people. Yes. What would be your thoughts on community, society and organisations in the whole social prescribing?
Well, I think, as I say, I think there is a lot happening, and there is a will to make it happen. Again, particularly in the not-for-profit, and I think the statutory service, like social services and probably primary care, would be very pleased to see it there and to see the results that it could produce.
So, if I could summarise what we've discussed thus far, and I'm of course very grateful for your time, Dr. Webb. Social care has a great and grave implication on our society in multiple different ways. Not tackling it is an awful thing and will imperil the continued survival of our National Health Service and the health of our people. There is a plan that exists, and you, of course, were an important member of the working group to come up with such a plan. And you have engagement, not just from Plaid Cymru, but other political parties have recognised the importance of fixing social care in various ways, but ultimately through the creation of a social care service. Would you like to add anything before we wrap up?
No, I only wanted to go back. It sort of touched a nerve, really, when you talked about research, everybody always wanting research. And I suppose I wanted to defend that, being a researcher, that research can often be the forerunner of the things that are later worked out in policy terms. And a particular example I think of, and we're talking about preventive care again, is that back in the, over 25 years ago, there was a piece of research carried out by academics from Swansea University, well, they were involved in it, into the effect of smoking. And they carried out this over a period of time. They measured the cost of the no-smoking advertising and publicity, and they set that against the cost of the lost days at work and those kind of associated illnesses. And it was so clear, the financial gap between the cost of the advertising and the publicity of no smoking and what it saved. You know, it saved so much more in society than the publicity had cost, that it seemed to me that that was a really perfect example of how research can say, look, here's the information, here's the data, here's your proof, work with it.
And that's a very nice example to end with on how fixing a problem, working out the costs, can actually be for the benefit of our entire society. Dr. Webb, I'm extremely grateful that you've spent this time talking to me today about the importance of social care and filling us all in on as to the details. Now, I know that all of the viewers here watching this will be as equally excited about fixing this important issue, this important problem, and of course one surefire way of contributing towards that is voting Plaid Cymru in the election in May. Thank you.
Thank you.